So welcome to our endocrine discussion. When we're looking at the endocrine system, we're mostly talking about hormones, which are chemical mediators of the body that help us to regulate all kinds of different bodily functions. Usually what happens is in endocrine disorders, something's going on where we have a hyper or oversecretion or hypo or undersecretion of an endocrine gland that causes a problem with our hormone levels. So some of our glands and what they secrete is where we'll start off here. The pituitary gland we call our master gland. It's very tiny, right? We actually have different sections of it. It gets divided in the anterior and the posterior lobes. The anterior lobe's job is to secrete different hormones such as the human growth hormone, thyroid stimulating hormone, adrenal corticotropic hormone, prolactin, follicle stimulating hormone, and luteinizing hormone. The pituitary gland has the posterior section in the back, and this gland's job is to secrete oxytocin, mostly in women to stimulate the uterus for pregnancy. There's also secretion of the antidiuretic hormone, which we talked about in your fluid and electrolytes section. Right, but the ADH has a very important role in our urine formation and to regulate our fluid balance in the body. Disorders with the anterior pituitary gland lead to problems like hypopituitarism, which causes a decrease or cessation of the release of hormones. So that would be lack of release for growth hormone, ACTH, thyroid, those types of things. Right. Depending on the hormone, you'll get different symptoms. So for instance, if you have a lack of stimulation of growth hormone, the person will be very small, right? Lack of TSH, they're going to have thyroid conditions, things like that. Hyperpituitarism is where we have an increase in activity of this gland, particularly with growth hormone, which can lead to gigantism, or acromegaly is the medical word, and prolactin levels to be high, which would cause abnormal milk production, even in men, if it secretes too much. Alright, the posterior pituitary disorders are mainly related to ADH problems. Alright, so it's produced by the hypothalamus and stored and released in the pituitary. If we have ADH issues, then we're back at either getting SIADH or diabetes insipidus. You can review those from fluid and electrolytes. Thyroid gland is in the neck. It regulates metabolism, protein synthesis, and we need it for growth and development in children. It secretes thyroid hormones such as T3 and T4. Right, if we see a hypothyroidism, we have a deficiency of these hormones, and hyper, we're going to have overproduction. Hypo is most prevalent in women and patients who have Down syndrome. It can be classified as primary or secondary. In primary hypothyroidism, it's an issue with the gland itself, and in secondary, it's an issue where the gland is not stimulated properly, usually from the pituitary or hypothalamus. Patients with hypothyroidism have issues related to a decreased metabolism, so they're going to have intolerance to cold, receding hairlines, anorexia. They'll often complain of thickening of their tongue, which can make it difficulty to talk. They can have hair loss, dry skin, feel very lethargic, have issues with constipation, muscle weakness, things like that. Hashimoto's disease is an autoimmune problem which leads the immune system to attack the thyroid tissue. This leads to gradual destruction of the tissue because it's getting infiltrated by lymphocytes and antibodies. In severe hypothyroidism, we might see problems like myxedema. This is a result from severe or long-standing hypothyroidism that hasn't been corrected. It can actually change the composition of the skin or dermis. Right? Patients will have non-pitting boggy edema around the eyes, hands, and feet. They also have thickening of the tongue, which could give them slurred speech and hoarseness. This is just an image of orbital edema, or in the orbits of the face. This is just another graphic image of hypothyroidism. To treat hypothyroidism, we focus on hormone replacement therapy, particularly using medications to help regulate their T3, T4, TSH levels. All right, medications we commonly use are Synthroid or Cytomel. Patients who are on these medications need to have blood tests regularly to test and monitor their levels to make sure they're having appropriate hormone replacement therapy and their medications don't need to be adjusted up or down. Hyperthyroidism is the opposite problem. So instead of being sluggish and not feeling like they have any energy, it's going to be the opposite. Right? It can also be called thyroid toxicosis, right, where they have excessive secretion of the thyroid hormones, which overstimulates their sympathetic nervous system. It can result from an autoimmune disorder called Graves' disease or from thyroid cancer. Other patients are at risk, especially if they're women and if they're identical twins, particularly for Graves' disease. Hyperthyroidism, they'll often experience a goiter, which is enlarging of the thyroid in the neck, and they'll be able to feel it on examination. Exophthalmos is the protrusion of the eyes, where it almost looks like they're bug-eyed and they're bulging. Patients will also be very nervous, they're going to be hot, have heat intolerance, experience weight loss for unnormal reasons, excessive sweating, tremors, palpitations, have issues with maintaining their emotions, so they'll have instability, maybe have irrational mood swings, and their hair is going to be very fine. They could experience a thyroid storm. This is an acute and sudden exacerbation of hyperthyroidism, and this would be considered a medical emergency. So just other images of the exophthalmos. This is a goiter. So Graves' disease is the autoimmune condition that causes hyperthyroidism. Right. What happens is that the thyroid stimulating antibodies bind to and stimulate TSH receptors of the thyroid to release too much TSH. This can also lead to the goiter of the neck, and it's seen often genetically in identical twins. To treat hyperthyroidism, it's targeted at trying to decrease the size of the thyroid or thyroid function. Right? They can try anti-thyroid medications, right, such as Tapazole or PTU. Right? They can also give them iodine. Iodine blocks the creation of T3 and T4 hormones. It can also decrease the blood vessels or vascularity of the thyroid itself. Beta blockers can give some symptoms or give relief to some of the symptoms related to like nervousness, high heart rate, jitteriness, things like that. They may try next radioactive iodine therapy. So the thyroid absorbs iodine, and what would happen in this treatment is they would attach radioactive isotopes to the iodine, and the patient would ingest it. The radiation would be traveling with the iodine to the thyroid, and when it got there, it would kill off part of the thyroid tissue to decrease its secretion. They could also go for a thyroidectomy. This is surgical removal of part or all of the thyroid. Right? If they don't respond to these other medications and radioactive iodine therapy, then they might recommend a thyroidectomy, or if it's caused by cancer as well. So they could just take one side or one lobe of the thyroid. They do a subtotal where they just leave one portion of a lobe, or they could do a total thyroidectomy. This is just a picture comparing and contrasting hypo versus hyperthyroidism. Next up is the adrenal gland. So you have two adrenal glands. They're in the abdomen, located on the kidneys. Their job is to produce hormones, amines, epinephrine, and norepinephrine. The three types of hormones they released are considered steroids. That's aldosterone, cortisol, and androgens. Adrenal insufficiency would mean that we're going to have hypofunction. This is called Addison's disease. So usually it's classified as primary or secondary. Primary is where we have a problem with the adrenals themselves, where more than 90% of both of them get destroyed. Secondary is because something outside the gland is causing the disorder, usually the pituitary, because the pituitary's job is to release ACTH, which stimulates the adrenal function. Symptoms include confusion, fatigue, weight loss, hyperkalemia, hypoglycemia, hyponatremia, hypotension, muscle weakness, decreased tolerance for minor stresses, which also contributes to mood swings, and skin discoloration. These can also, Addison's disease can also be related to steroid medication use. So patients have been on steroids either for medicinal or non-medicinal purposes. It's important to monitor them for adrenal insufficiency concerns. An Addisonian crisis is when there's a sudden, acute adrenal insufficiency. It can be lethal and is considered a medical emergency. There's a rapid decline in cortisol and aldosterone levels. It is often associated with some type of stressing event, such as illness, pregnancy, or an emotional stress. This is a video from the doctors about Addison's disease and recognizing it. If you're interested, you can watch that for some more info. To treat Addison's, they'd have to identify if it's primary or secondary and then treat the disease. The focus is on hormone replacement therapy, right? Particularly steroids to correct imbalances. They may need IV fluids, such as salines, to treat hypotension until it's corrected. And they may need vasopressors to help with their blood pressure to bring it up if they're having low BP issues. Cushing's disease is whenever we have hyperadrenal function, right? If it's primary, that means it's in the adrenal gland itself and they are secreting too much glucocorticoids. Secondary is caused by a hyperfunction of ACTH from the pituitary, and then we can also have tertiary where there's an injury to the hypothalamus. Typically it affects people between 20 to 50 years old who have been receiving steroids. Cushing's syndrome is whenever patients have symptoms related to this problem. Alright, so there is hypertension, cardiac arrhythmias, low potassium, fluid retention, high blood sugar or hyperglycemia, a moon face, which is very characteristic of this condition, increased fat around the neck, impotence in men. Women may develop excessive hair growth in abnormal places such as their face, neck, chest, and thighs. They may also have irregular periods. Both men and women can also have bruising of the skin easily. Purple stretch marks develop on the abdomen, a buffalo hump in their upper back, muscle wasting, and poor wound healing. This is an image of some of the problems that are caused by Cushing's. So particularly the moon face and buffalo hump, as well as the fluid and weight retention are common problems. This is also a video if you're interested in learning more about Cushing's. You can watch that. To treat Cushing's, the goal is to normalize hormone secretion and treat the underlying cause to correct the problems. You can give some medications to inhibit adrenal function and try and suppress cortisol production and use in the body. Right. Next up, we will pick up with the pancreas.